Well, hey, everybody, this is Robert, and welcome to Outbreak News TV. And on today's program, I want to take a look at the ever evolving measles case. And today, I'm going to talk about what's going on briefly in the USA, in Canada, in Mexico, as the numbers continue to increase in all three countries. Well, let's go ahead and start in the US. And as of Friday, March 21st, there's been a total of 407 total cases reported in 18 states and New York City. Now, the latest states to report measles include Ohio and Tennessee. Things that I'm keeping an eye on is the situation in Kansas. Kansas saw another 9 cases since our last report, so they're up to 10. California saw 3 more cases, and Maryland saw 2 additional cases from Prince George's County, which borders Washington, D.C. When we look at the outbreak cases in Texas, health officials now report 309 outbreak cases have been identified since late January, and that has risen to 14 counties affected. And this includes more than 200 cases in Gaines County alone, which is essentially the epicenter of this outbreak. 40 of the patients have been hospitalized. Now, in New Mexico, Lea County, their case count has risen to 40, so that brings the state outbreak total up to 42. Let's go north of the border, and they're seeing measles issues matching, if not worse, than what's going on in the U.S. Now, there's been a total of 440 measles cases, of which 357 were confirmed and 83 probable, reported just in the province of Ontario as of March 19th. Now, all but 7 cases are linked to a multi-jurisdictional outbreak. So just a handful have been travel associated. And officials say the sharp increase in the number of outbreak cases and the geographic spread in recent weeks, and you can see on the map that it has spread to 6 different provinces now, is due to continued exposures and transmission among individuals who have not been immunized. No surprise there. Some of the numbers we're seeing are among infants, children, and adolescents in Ontario. About 93% are unimmunized, and about 65% are unimmunized among adults. 34 outbreak cases have required hospitalization, including 2 who required intensive care. Among the hospitalizations, 32 were unimmunized, including 29 children, and 1 child required intensive care. And another hot spot in Canada is Quebec, and their measles total has risen to 40. And I hope I pronounced this right. The Laurentides region is by far the most affected area, and they have 32 cases there. And something that's really I've been keeping an eye on the past week is what's going on in Alberta, more towards the west coast of Canada. Their tally has risen up to 13, and this is including cases in the cities of Edmonton and Calgary. But that number has been rising pretty quickly, so I'll be keeping an eye on that as time goes on. And then the other part of the triad, which really haven't talked about until today, basically, it's what's going on in Mexico. And the health secretary in Mexico, his name is David Kirschenbisch. I may have mispronounced that. He called on at-risk populations who have not been vaccinated to get vaccinated against measles and whooping cough. So they're battling both, like all us other countries are, to prevent infection during the outbreaks. Quote, the most important recommendations in the face of this measles and whooping cough outbreak is to monitor for symptoms, but above all, to ensure that at-risk populations get vaccinated. All community centers and hospitals have the vaccine available, he emphasized. Participating in President Claudia Sheinbaum's morning press conference, the People's Morning Press Conference, the Secretary of Health affirmed that there are sufficient vaccine doses to cover all the country's needs. He explained that the measles, mumps, and rubella vaccine is administered at 12 and 18 months of age. Therefore, anyone who has only received one dose should receive a booster. The health minister specified that it is also recommended that children under 9 years of age, adolescents, and adults between 11 and 39 years of age, as well as healthcare personnel under 39 years of age who have been in contact with positive cases, receive a single dose of the measles rubella vaccine if they do not recall having been vaccinated. And he notes that those 40 years of age and older do not require this vaccine. Moving on with Mexico, we have some numbers. Regarding the current measles situation in the country, the health secretary reported that there's been 39 cases detected in Chihuahua, the state of Chihuahua, and another 4 in Oaxaca. All are imported or associated with importation. In the case of Chihuahua, none of the affected individuals had a vaccination history. He went on to announce that National Vaccination Week will take place from April 26th to May 3rd, during which 14 vaccines will be administered to control diseases such as polio, measles, tuberculosis, and rubella. He explained that specific coverage goals will be established in each state. Also at the press conference, Eduardo Clark, he's the Undersecretary of Sectorial Integration and Coordination of Healthcare Services, presented the progress made in the purchase, supply, and distribution of medicines and supplies for the health sector. He noted to date that 4.7 billion units have been purchased at a cost of 248 billion pesos. He specified that 74 million units of vaccine have been purchased and have arrived in the past couple weeks, and they expect another 239 million units to be delivered soon. This will allow for significant increase in availability of medications and for hospitals and clinics in the different sectors. And then finally, I just want to talk about briefly some recommendations from the CDC. And they're continually updating their travel advisory for people traveling internationally. And dozens of countries, as you can see on the map, which are international travel destinations, are reporting increased numbers of cases of measles. Now, the CDC says travelers are at risk of measles if they are not fully vaccinated 2 weeks prior, if they have not been fully vaccinated 2 weeks prior to departure and travel internationally. Vaccination with a measles-containing vaccine is the best way to make sure that you are protected. Infants 6 through 11 months of age should receive 1 dose of MMR vaccine. Infants who had 1 dose of MMR vaccine before their first birthday should follow the recommended schedule and get another dose at 12 to 15 months and a final dose at 4 to 6 years. Children 12 months of age or older, teenagers, and adults who do not have presumptive evidence of immunity against measles should receive 2 doses of MMR vaccine separated by at least 28 days. If the child received the first dose with MMR-V, that includes varicella, they should wait 3 months before their second dose. CDC goes on to say, if you are not sure if you or your travel companions are fully protected against measles, schedule an appointment to see your clinician at least 6 weeks before traveling so that you have enough time to get vaccinated. And then lastly, some people should not get a measles-containing vaccine or should wait. If you don't think you can safely receive a measles-containing vaccine, talk to your clinician and consider making alternate travel plans. So yeah, so we're seeing that measles is seeing high numbers in North America this year, and it doesn't look like it's slowing down anytime soon. Canada, US, and Mexico. Obviously, Mexico's big concern is what's going on at the Texas-New Mexico border, and the concern of more and more imported cases in travel. And travel is a big issue too, as stated by the CDC. So, if you're not vaccinated or your children are not vaccinated, that's the thing to do, because there's a lot of complications that can come along with measles, and on occasion, rare occasion, it can be fatal. So keep that in mind. And let me just close with, if you enjoy this video, please subscribe to the channel, like the video, comment below, share with your friends, and I'll see you next time on Outbreak News TV.